Hi everyone, this is Dr. Taramanchi. I wanted to quickly say hi to you, talk about some news that just came out about COVID-19 and nursing homes. The CMS, the Center for Medicare and Medicare Services, is now going to penalize nursing homes which are not reporting the data back to CMS about deaths from COVID-19. So far, they're reporting around 26,000 deaths from COVID-19 in senior facilities. So I believe this is a good development because we'll have more transparency, and it will also help with families making a decision. You know, if one facility has a lot of COVID-19 deaths or a lot of infections, then they can potentially remove their family member from there and move them to a different facility or even home. So I'm hoping that this is going to create a major change in how nursing homes work, and it also brings to the spotlight on how we treat elderly people. Hi, Candy. So I have noticed some families are completely against putting seniors in a facility, whether it's assisted living or nursing home, and some are open to putting them in a facility. So the problem with putting people in a facility is anytime there's a major infection, whether it is influenza or COVID or any other infection that's going to spread really fast, you run the risk of the family member either contracting the infection or even dying from the infection. So obviously, home is the best choice, but if you're not able to take care of them at home, then the only choice is to put them in a facility. And this is where I feel that there's a huge gap in medical care, because the traditional medical care really does not offer much in terms of strategies to prevent that from happening. I have a lot of friends in the holistic arena. They do some of these modalities that are considered complementary. I personally do energy healing. And although there is no research to back this up, I feel that if you're able to do those modalities and provide them maybe extra 10 years or 20 years where they can spend that time at home, that will give a better quality of life. That will also help them live a happier existence. I don't know how long this restriction from COVID-19 will last. Hi Patricia, hi Ed, thanks for watching. So I don't know if it's going to be 6 months, or I don't know if it's going to be the next 2 years, especially them restricting visitors in the nursing homes. As I've said before, loneliness is very dangerous when you're at that age, because you want to be interacting with people. For the younger people, it's not a problem, because we interact with people whether we're in the store or whether at work or whatever. We continue to interact with people. So I want to quickly share that thought with you. There has to be a better way of dealing with aging in general, where you're promoting a quality of life, where you're providing more time at home rather than putting them in a facility. So think about that. Think about some strategies around that. Obviously, nutrition and other things also play a role. I've noticed some doctor friends who have prescribed growth hormone to their elderly parents, and somehow that has helped. If you read a traditional medical literature, they don't let us prescribe growth hormone unless we prove to them that the IGF-1 levels are off or the growth hormone levels are really low. So unless we prove to the insurance companies, they are not going to reimburse for growth hormone. And FDA is very strict. They don't let us prescribe growth hormone for other indications. But I've known some doctors who have prescribed growth hormone to people in their 40s, 50s, 60s, and that has really transformed their physical functioning level and so forth. So there are options outside of the traditional medical box that we live in. There's something to think about. Maybe those options should be allowed more often, where people can use those options to extend their time at home and be more physically active even in their 80s and 90s. So hi Kim. So I wanted to share some of those pointers with you quickly, and so I wish you all having a good night. I'm still sad to know about what's happening outside in terms of the rioting and the protests and everything. Hopefully this will die down soon. Um, so, if you want to chat with me privately, send me a DM. You can email me. Have a wonderful night. Okay, bye.